2. Why was it missed at first? In October 2021, he was rushed to the hospital. When he arrived, he had altered consciousness. His Glasgow Coma Scale, or GCS, was just 5 out of 15. That reflects very severe impairment of consciousness, and this is exactly what made the case so misleading. By that point, he was critically ill. And yet, many of the classic warning signs people might expect still were not all there. He had no meningeal signs. His cranial nerve exam was normal. His eye exam was normal. His hearing assessment was also normal. His family could not identify a clear trigger. There was no fever, no history of seizures, no definite hearing loss, and no clear visual decline. All of that made the disease even better at hiding itself. This time, however, his brain MRI was no longer normal. The imaging showed high signal in the mammillary bodies, high T2, and flare signal in the periaqueductal grey matter, and mild abnormal signal in the medial thalami, but the basal ganglia were normal. The white matter was normal. Brain volume was normal, and there was no brain atrophy. That MRI pattern first raised concern for thiamine deficiency, and it also brought mitochondrial disease into the differential diagnosis. In other words, the MRI was already telling doctors this was not a simple problem. There might be an underlying metabolic disorder or an energy pathway abnormality. But the scan did not directly say, this is biotinidase deficiency. What made things even more confusing was that routine lab tests also did not sound the alarm. His complete blood count, liver and kidney function, blood gas analysis, and ammonia were all essentially normal. And if you focus only on those numbers, it is easy to think, maybe this does not look like a classic metabolic crisis. There was also a real-world limitation. At that time in Iraq, testing for biotinidase enzyme activity was not available, so the most direct and standard confirmatory pathway was simply not possible. In the end, the test that finally revealed the diagnosis was genetic testing. It showed that the child had a homozygous